Hi, today we are going to introduce one more platform that is called MedFlow. What is meant by MedFlow? MedFlow is like, we have designed it for the Indian future healthcare and world future healthcare. So, one of the complex projects which we have designed from last 3 years. So, healthcare is one of the most important systems for the world. When we looked closely, we didn't just see inefficiency, we saw fragmentation, patients' records in one place, lab results in another, doctor's notes somewhere else, and none of this truly not connected. So a patient is not just data, but today they are treated like a disconnected records, and that's where everything starts to break.
Hello everyone, I'm Chinmay, working as a backend system engineer for the project MedFlow. So, as we all know, hospitals now run on multiple independent models like appointments, billing, records, and diagnostic. When these systems don't truly communicate, that is when the actions are isolated, which creates delay, inconsistency, and operational gaps. And when these systems don't communicate, people are forced to do manual work. Manual work leads to delays, and delays leads to mistakes. So we didn't just connect systems, we made them think together.
Hey, hi, this is Harish Alamtoju, Developer Relationship Head at Neeroma and working for MedFlow. So today I'm going to explain about what patients are facing in multi-specialty hospitals and in medical industry. So from the patient side, healthcare feels complex and unclear. You don't know where data is, you don't fully understand your reports, and you don't know what to do next. And the confusion becomes critical because when people don't understand, they hesitate, delay, or make wrong decisions. Technology should not confuse, it should guide them. So, every screen, every interaction was designed to reduce fear and increase the clarity.
Hi, I'm Geeta, working as clinical system engineer at Neeroma for MedFlow. From doctor's perspective, there is an overload of information: medical history, lab result, imaging, prescriptions, so on. But none of it comes together as clear, usable insights. So decisions depend on time pressure, not just knowledge. And when time is limited, important signals get missed. Doctors don't need more data, they just need right insights at right time. That's where intelligence becomes crucial.
So we ask one fundamental question: what if healthcare could think, not just like store the information, but understand the patients completely in real time?
Hey everyone, this is Raghavendra, the product head for MedFlow at Neeroma Technologies. So we designed MedFlow as a unified architecture. So every portal like patient, doctor, staff and admin is connected through a single intelligent system. So not as a separate modules, but as one continuous foundation. So because when systems are built in isolation, so they break as they grow. So this was not about adding features, it was about building something that can evolve around, and a system that can scale, adapt and grow with healthcare itself.
Hello everyone, myself Guleshri Achan. I am a data and a workflow engineer in Neeroma Technology. So in MedFlow, every action triggers a structured workflow. For example, booking an appointment, updates schedules, notifies the staff and logs the patient's data. Here everything happens in a sync across the system. But in a traditional system, workflows are static and break under real conditions. But in MedFlow, workflows are completely dynamic. They adjust in a real time based on the data and what's actually happening on the ground. So here we can get to know that it does not just follow the steps, it actually responds.
So building AI for healthcare is fundamentally different. So it demands precision, context and the accountability. So because here every output can influence a real decision. So this is not just intelligence, this is a responsible intelligence. AI is powerful, but in a healthcare, power alone is not enough. It has to be accurate and explainable and as well as reliable. Because in this space, there is no room for uncertainty.
I'm Suhas, and system in AI system engineer at Neeroma as well as MedFlow. We had to connect multiple layers, patients' data, hospital operations, AI systems, and even a small mismatch can break the entire workflow because every system speaks different language. Our job was not just to connect them, but make them understand each other. That's where the true integration begins.
Hi, I am Abhishek, working as infrastructure engineering at Neeroma Technologies. So the system has to run continuously, no downtime, no lag, no data loss, because this is not something people use casually. This is the healthcare. When the system fails, it's not just an error; it's a critical movement loss. Scaling is not just about handling more users; it's about handling those movements without fail. Because in the healthcare, every second matters.
So, medical decisions carry real consequences. So, every prediction, every insight has to be clinically safe and reliable because AI can suggest, but in healthcare, it must support decisions safely. And that means every output is validated against clinical standards and real world use cases. So, not just intelligent but trusted.
Hi, my name is Raghu, working as a test engineer at Neeroma Technologies. When I started testing on this application on MedFlow, the agent we built one engine to classify everything. So we get wrong decisions and we have validated 100 number of test cases. That's when we realized something critical. A single AI system is not enough, but one AI gives answer. But multiple AI layers gives perspective because in healthcare, decisions are need comparisons and cross validations and multiple layers of reasoning. And that's how decisions are made. So we built a network of 22 specialist AI agents.
So basically, each agent is trained for a specific clinical domain. So like radiology, pathology, cardiology, drug safety, and predictive analytics. Each one operates like a specialist, focusing deeply on particular area. When they work together, they don't just add insights. They build a clearer, more reliable picture, like a team of specialists reviewing the same patient from different angles.
Basically, we extended this to multiple domains like mental health, pediatrics, infectious diseases. So, every patient receives multi-specialist analysis.
At the center of the system, we built an architecture, a core intelligence layer that brings together all agents' outputs into one unified clinical recommendations. So because without architecture, multiple intelligence systems create noise, conflicts. So but with architecture, those same systems are aligned, validated, and turned into a clarity. So instead of many opinions, the doctor receives one clear, reliable direction.
So in MedFlow application, the system dynamically selects which agents to activate. For example, based on the symptoms, case types, and the patient history. So instead of running everything, it only collects a relevant information regarding to that cases. So this is actually not a rule-based automation, it is an adaptive intelligence because as the case evolves, the system adjusts, bringing the right expertise at the right time. So here we'll get to know that it doesn't just follow the steps, it actually adapts to the patient.
So coming to the patient portal, when we thought of patients from all over the world and mainly in India, when we plan to go every corner of India and every patient in India, we thought how they will book their appointments, how they will ask the questions in their own language. The idea was born there. So we have come up with one unique thing where patient can call directly and book their appointments in their own language, like how they are talking to their phone, like their friends or family in their own language. And even they have many more questions or queries or anything about their health, they can clear. And the system responds and understands and reply in their own language.
Every request triggers multiple backend processes like validation, processing, AI analysis, and database updates, all executed in real time. Because in healthcare, speed matters, but correctness matters more. So every process is designed to be fast and clinically reliable. Not just quick responses, but the right ones.
So basically all portals are interconnected. Patient systems, doctor workflow, staff operations and admin intelligence. Everything flows through a single ecosystem.
So, doctors now work with intelligence, AI diagnostic, predictive insights, lab analysis. They don't just see the data, they understand it.
So when it is coming to the patient portal, so when patient logins into the MedFlow, so once after login, you have full access to his medical history, vitals, reports and prediction. So especially when it's coming to the prediction, so we have a separate engine where our engine helps predicting the long-term health risk insights, and also with the insights the patient immediately can consult a doctor, take the medication and take care of himself for the future health risk.
Basically, the system is designed to scale across hospitals, networks, and government healthcare systems. Because healthcare does not stay in one place, right? It expands, connects, and evolves. So this is not built just for today. It is built to support the next generation of healthcare systems without breaking as it grows.
Hi, I am Praveen, an AI workflow engineer at Neeroma Technologies, and I am working with MedFlow as well. For years, healthcare has been reactive. We wait for symptoms, we wait for reports, we wait for problems to appear. But what if we didn't have to wait? And what if healthcare could predict, prevent, and guide? MedFlow is not just a platform, it is a shift from fragmented systems to unified intelligence, where every patient is understood, not just recorded, where every doctor is supported, not just burdened, and where healthcare finally becomes proactive.
This is all about the MedFlow, built to think, designed to care. Finally, at your glance, coming in the next week, we are going to release. Thank you.